Hey everyone, welcome back to Biz TV Health Talk. I'm your host, and if you've been following the series, you know we've been diving into how inflammation shows up across the body, sometimes as a warning, sometimes as a wildfire. In our last episode, we looked at appendicitis, an urgent gut explosion. Today, we go deeper into the lungs, into what made COVID-19 so dangerous for some people. This isn't just about the virus. It's about what your own immune system can do when it loses control. Inflammation is your body's first responder, rushing to heal cuts and fight germs. Redness, swelling, and warmth are signs your immune system is protecting you. This controlled response is essential for survival. But sometimes, the system goes into overdrive attacking healthy tissue. That's when inflammation turns from friend to foe, leading to chronic problems. The balance between helpful and harmful inflammation is delicate. When a powerful threat like COVID-19 appears, it can tip this balance, causing the body's defenses to spiral out of control. Understanding this dual nature is key to grasping why some illnesses become so severe. The story of the cytokine storm in COVID-19 shows just how powerful and dangerous our immune response can be. Cytokines are tiny protein messengers that help your immune system communicate. When a virus invades, cytokines sound the alarm, calling immune cells to action. Normally, this is a precise, controlled process, but in some COVID-19 cases, the body releases a flood of cytokines, a cytokine storm. This storm causes hyperinflammation, damaging healthy organs like the lungs and heart. The immune system, meant to protect, now attacks the body itself. This overreaction can lead to severe lung damage, blood clots, and organ failure. In many critical COVID-19 cases, it's not just the virus, but this runaway immune response that causes the most harm. The cytokine storm is a dramatic example of how our defenses can turn against us. Managing this response became a central challenge during the pandemic. Why do cytokine storms strike some people and not others? Older age, obesity, diabetes, and high blood pressure all raise the risk. Genetics also play a role. Some people are simply more prone to an aggressive immune response. A high viral load can push the immune system into overdrive. It's a mix of health, genetics, and the virus itself. Recognizing warning signs is crucial. Severe shortness of breath, confusion, chest pain, low oxygen. Remember the acronym STORM. These symptoms mean the body is in crisis. Early recognition and medical help can save lives. If you or someone you know experiences these signs during illness, seek emergency care immediately. Acting fast is the best defense against the damage a cytokine storm can cause. Awareness empowers us to respond quickly and decisively. Understanding these risks helps us protect ourselves and others. At the start of the pandemic, doctors had few tools to fight cytokine storms. Supportive care like oxygen was the first step. Breakthroughs came with corticosteroids such as dexamethasone, which calmed the overactive immune response and saved lives. Targeted drugs called immunomodulators were developed to block specific cytokines, offering a more precise approach. Today, doctors can identify high-risk patients and start treatment early, preventing the storm from escalating. This new toolkit, supportive care, steroids, and targeted therapies, has become the standard worldwide. The fight against COVID-19 has deepened our understanding of inflammation and critical illness. These advances are now helping in other diseases where the immune system overreacts. Global collaboration has accelerated progress, preparing us for future challenges. For many COVID-19 survivors, especially those hit by a cytokine storm, recovery is a long journey. Long COVID brings lingering symptoms like fatigue, brain fog, and joint pain. The intense inflammation can leave lasting damage, making healing slow. Recovery often requires physical therapy, mental health support, and careful management of inflammation. Healthy habits, balanced diet, gentle exercise, and good sleep are crucial for healing. Some may benefit from supplements like omega-3s to support a healthy inflammatory response. The pandemic has shown how vital it is to keep inflammation in check for long-term health. Next, we'll explore how inflammation affects chronic joint diseases and why balance is key to staying active. Understanding and managing inflammation is fundamental to living well. Thanks for listening to Biz TV Health Talk. This episode is for education only. Brought to you by XL Health TT and Times Square Media. Always consult your doctor for any health concerns. This podcast is for informational purposes only. It is not intended to diagnose or treat any medical condition. Please consult a licensed healthcare professional for personal medical advice.